Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I have been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, my disclaimer reminder that I always like to go over is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Now, we've been on our antibiotic kick and series, and I'm just going through the systems as promised to help you apply it. So now we're hitting tuberculosis, all right? Still in the respiratory system. Question number one states the nurse practitioner has diagnosed the patient with active tuberculosis. What is the first line treatment option? Is it A, rifampin and INH? Is it B, rifampin, INH, and ethambutol? C, rifampin, INH, pyrazidamide, and ethambutol? Or D, augmentin? Take a moment and tell me what you got. All right, I always recommend reading the stem of the question first, as this allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, what is the first line treatment option, right? So again, when they're asking you for a treatment, you need to run it back and see if they provided you with a diagnosis. If they have not, you need to take it back a step further and look at the assessment findings to determine what the diagnosis is. Here, the diagnosis has been provided as active tuberculosis, and then it's asking you for the first line treatment. Now, with active tuberculosis, we treat, they tell you to think of RIPE, RIPE. You treat with rifampin, INH, pyrazidamide, and ethambutol, all for the antibiotics, right? The anti-tubercular agents, but they are antibiotics, okay? So C is your best answer. And in a minute, I'll explain active and latent, okay? All right, question number two. The nurse practitioner has diagnosed the patient with latent tuberculosis. What is the best treatment option? Is it A, amoxicillin, B, Bactrim plus INH, C, ethambutol and INH, or D, INH and rifampin? Take a moment and tell me what you got. All right, now here, the stem of the question states, what is the best treatment option? So again, if it's asking you for a treatment, you need to run it back and see if they have provided you with a diagnosis. Here, it has provided us, letting us know that the diagnosis is latent tuberculosis. Now, with latent tuberculosis, how do we treat? Now, with latent tuberculosis, we're only going to use D, INH, and rifampin. Now, with active, we use all four. Sometimes they'll tell you 1, 2, 3, 4 latent, but the latest guidelines say treat with just the two, INH and rifampin, and then you can gauge based on a short course dosing style of 3 months of this, or you can extend it out. It can go as far as 6 and 9 months of treatment, okay? Now, my big spiel, because I get a lot of questions where I have worked with review students, and I can determine that y'all are not completely confident in understanding latent versus active TB. Now, with latent and active TB, what happens is, okay, patient comes in, your PPD is positive, right? So let's start with latent. You have a PPD test, it's positive. Now we need to go to our gold standard confirmatory diagnostic exams, being chest x-ray and or sputum culture, right, for tuberculosis. With latent, it will be negative, right? So the chest x-ray or sputum culture will be negative, but the PPD is positive. Patient is also asymptomatic. And I know you're probably like, well, why are we doing this? Think about like us, like healthcare providers or whatever may have warrants a PPD or assessment, right? T-spot, whatever you want to do. You come in, you have this done, and bam, you have a positive reading. But you're asymptomatic and the confirmatory are negative. It's latent. you're not contagious, but there's treatment that still is warranted. So that's why we move forward with our INH and rifampin. Now, on the other hand, active TB is the full tuberculosis that you are commonly familiar with. They're symptomatic, they have the night sweats, they have the weight loss, they have the cough, they may have hemoptysis with the blood in their sputum. The PPD will be positive. The chest x-ray or sputum culture will be positive. They have all of the things. They check all of the boxes. They are contagious. You do need to quarantine them. You do need to report this to CDC. All of these things is a reportable disease. So all of the things with the active TB, right? So then you need to treat them completely with all four. Remember, right again: rifampin, INH, pyrazidamide, ethambutol over a 6 to 9 month period. Okay. So make sure y'all know latent versus active, so that if you see a question like this and they're giving you this patient and it's presenting in this fashion, they're asymptomatic, PPD is positive, chest x-ray is negative, sputum culture is negative, so you know what to do. You still need to treat them, but know how to treat them. Okay. So don't let that trip you up. All right. And then lastly, question number 3, the nurse practitioner and NP student are discussing active TB first-line treatment options. The NP student notes that she is aware that rifampin, INH, pyrazidamide, and ethambutol are first-line treatment options, but is inquiring as to what other antibiotic can be utilized in combination with those medications. What is a correct response by the nurse practitioner? Is it A, amoxicillin? Is it B, augmentin? Is it C, azithromycin? Or is it D, moxifloxacin? Let me know what you got. All right, so still the question here: what is the correct response by the nurse practitioner? So what are we responding to? So they're discussing first-line treatment for active tuberculosis, but the NP student is saying, hey, I know that we treat with RIPE, rifampin, INH, pyrazidamide, ethambutol, but there's also other options that you can utilize in combination. So what is that? So there is one other alternative that you can utilize, which is D, moxifloxacin. And they typically do that with your your rifampin, your INH, and your pyrazidamide. Okay, so INH, your rifampin, pyrazidamide plus the moxifloxacin. Okay, remember moxifloxacin is a respiratory fluoroquinolone. Remember my Brittany's Brilliance, get my lungs, because we're getting those respiratory systems together. So we're trying to get our lungs together, right? So G, gemafloxacin for get. M, my moxifloxacin, lungs, L for lungs, L for levofloxacin. Those are your respiratory fluoroquinolones. So again, moxifloxacin is also an alternative in combination with those. Okay. All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and be sure that you meet me back here. Now, also share with whomever you may think may find this beneficial as well. If y'all have specifics that y'all are struggling with, let me know. But again, we will continue to work through and navigate through all of the systems and applying antibiotics to it, okay? And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. The things that I do offer are my review book. You can get it in an ebook or paperback option. They're both linked in the bio of this channel. If you're someone who prefers reviewing on your own independently, I do offer a self-paced review for family and adult Gero for both exams. That's also linked in the bio of this channel. If you're looking to book a one-on-one session, I always say either give us a call, shoot us an email, as all one-on-one sessions are customized, so we want to adequately gauge what you truly need. And then if you're looking to utilize any of the QBank options, they're all linked in the bio of this channel as well, okay? All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.